And again, speaking of exciting times, we're going to move on to Professor Louise Dubras, and I can't see Louise, so apologies.
I'm here.
Oh, hi Louise, how are you? And Louise is here today. Really excited to hear Louise speak today. And Louise is going to speak to us about the development of the School of Medicine and the transformational impact of the School of Medicine for the people in the local area and the prosperity and for the city and the district. So as we know, really exciting time for the School of Medicine in the city and the area and the region. So Louise, you're really, really welcome, and I'm going to pass the floor over to yourself. Thank you.
Well, Fiona, thank you so much, and thank you, colleagues, for asking me to speak to you today. Now, I'm going to try. I mean, I echo what Paul said. You know, following Tim and then Paul is a bit of a tall ask, but I'll do my best. And I have a few slides now. I don't know if I'm able to share or whether Joe might need to share those for me, because it doesn't look as though I can. Oh, wait, I think I can. Here we go. Can you see those? Oh, no, not yet. But can you see them now? No, because I've shared the wrong screen. Can you see my slides?
Yes, we can indeed.
Marvellous. So is there a slide that says people, place, participation, prosperity?
Absolutely, yes. You're
fantastic. Anything might happen. But I think it's really important to situate myself, if you like. So as well as working at Ulster University as a professor of medical education, I'm also a GP in the city of Derry, Londonderry, and I've been here for 3 years. And oh golly, is my slides going to work? Oh no, I can see this is not necessarily going to be as easy as I hoped it would. I wonder if
Joe, do you want to maybe share?
I wonder, Joe, could you share, and then I'll just tell you when to put the next slide up.
Joe to the rest.
Is Joe still with us?
Yes, yeah.
Just to confirm, Joe's working away here to get the slides shared.
Fabulous. They are the exact same slides. I haven't changed them. Thanks, Joe. So can we move on to the next slide, please? Because actually, having been here 3 years, I was really heartened to hear what Tim was saying, because what a place. Derry City is an amazing place, and I have really developed an absolute fondness for here, and it was really interesting to hear him talk about the Greenway project. In fact, it was the mayor was talking about the Greenway project, and to be there and to use it and to really benefit from it and to witness so many people from my window throughout lockdown using the Greenway was just testament to its success. But Joe, could I have the next slide, please? So I've come here and settled, but I think I just wanted for a moment just to think about the university. We have served the health needs of our communities throughout Northern Ireland for 47 years, and I don't think it's an underestimate to say that the School of Medicine is a game changer for the region. And I'll talk a little bit more about how we're supporting health and well-being by investing in our future doctors, but additionally positioning this area as a really amazing place to study and work. We're bringing in high quality staff already from elsewhere in the United Kingdom. We've got staff joining us from around the world, and I think that's testament to a number of things. I think it's testament to the excitement of coming here to this university in this city. I think it's the excitement and prospect of starting something new, of contributing to a community, and certainly those are amongst the things that tempted me to come here. So we're seeing the evidence already. Joe, could I have the next slide, please? So just thinking a little bit about participation, we will be delivering a unique programme. So it's a Bachelor of Medicine, Bachelor of Surgery medical degree, and this is the first in, it's the second in Northern Ireland, the first opportunity for students who have a prior university degree to come in and study a 4-year intensive training programme. At the moment, if students have a prior degree, they can study at Queen's University Belfast, study medicine, but they have to join the 5-year programme, so it takes longer for them to graduate. So this way our graduates come with a wonderful eclectic background and graduate as very well-rounded doctors after 4 years. And our ambition is that our graduates will work to improve the health of their patients and the wider community. We all know about our ageing population. The longer we live, the more multiple long-term conditions we experience. And I'm sure that none of you need me to tell you about the extent of mental health problems and distress in our patients. As alluded to, I think, by Tim, that and Paul also, that has not diminished through COVID. If anything, that has become worse. So our vision is to train locally focused, globally ambitious change agents. Joe, can you move the slide on, please? So as a GP myself, I experience the pressures in our system every single day that I'm at work in the surgery. The way we've had to change our delivery of healthcare, Paul talked about just now, but the delivery in the last 15 months has been nothing short of astounding. In general practice and in hospitals, between the remote consultations, having to move to wearing full PPE to see patients, having to staff the COVID centre, something I really never ever thought that I would have to do at this stage in my career, and then contributing to delivering the vaccination programme. I have to say that for me has been such a privilege, actually, to vaccinate particularly our oldest patients, people who were locked down for 15 months, came out for a vaccine, and it was nothing short of almost miraculous for some of them. The response was phenomenal. But our staff have worked to their limits. I have to say, I don't think I have ever worked so hard under so much pressure as a GP. But throughout all of that time, we've been bringing on the plans for our School of Medicine, and we are going to contribute an extra 70 doctors a year to the workforce. And you know, Paul talked about waiting lists. We have massive problems with waiting lists here in Northern Ireland. I was completely horrified when I came here and realised just how bad things are, and COVID, of course, has made things worse. But in 2018, the Department of Health recognised that we need more doctors, we need more medical students, and so we've been absolutely delighted that Ulster University was granted the go-ahead to recruit. Can you still hear me? So it's about trying to train our students to become doctors. Joe, can we go for the next slide, please? So I'm just going to give you a very quick update on our progress. So we have a curriculum, and we're working in partnership with St George's in London. We're working with the General Medical Council for accreditation of our programme. I've already talked about recruitment of academic staff. Clinical staff recruitment is underway, and that's already some new doctors into our local system, and also recruited administrative and technical staff. We are refurbishing a building on the Magee campus that is well underway and on track. We conducted our first student interviews in February of this year, and we've made offers, and we're doing further student interviews scheduled the week of the 14th of June. Those were really exciting because amongst the people who we were looking at on screen, which was a little unusual in itself, but we realised that we're seeing some of our future doctors for the first time in February. And the really exciting, if somewhat alarming, number there is that our students will actually start with us on the 23rd of August 2021, which is 3 months away. So I'm really delighted to be here with you this morning, but I must admit there's quite a lot to be doing alongside. Jo, could you give me the next slide, please? And this is my penultimate slide, actually, but I really, really wanted to just, given what's been spoken about already, felt it was really important just to spend a moment thinking about prosperity. Now, I just put a real sort of soundbite there. More wealth equates to better health, but I think it's really important just to look at that data very, very briefly. And I've put two images there on the slides. So one is the difference in male life expectancy and female life expectancy in Northern Ireland between the most deprived and least deprived areas. And you can see that basically health inequalities cause people to die younger. So men in Northern Ireland die 7 years younger in the most deprived over the least deprived areas. And for women, the gap is 5 years. I worked before coming here as a GP to homeless people in the south of England for many, many years. And the life expectancy for a homeless man in this country is around about the age of 45. Now you can see there on that top line that the life expectancy for a man in the least deprived areas of Northern Ireland is 81.6. So compare that to 45, and that tells you how social exclusion, poverty, distress claims lives early. But I think the causes are complex, they are multifactorial, but the second image there is from Sir Michael Marmot's report. That was the follow-up to his original report about health inequalities, and sadly very little had changed in 2020 compared to 2010 when his original report was published. But just picking 3 recommendations, and actually this is why it's so important that we're working in partnership. 3 recommendations to improving life expectancy include giving every child the best start in life possible, creating fair employment and good work for all, and creating and developing healthy and sustainable communities. And you know, doctors, as previous speakers have said, this is not about having a national illness service. We really need to be working together so that our national health service focuses on community health, focuses on public health, focuses on mental health. And we work in partnership with our civic leaders so that our communities become generally healthier. I think it's important to say I believe that health professionals, and obviously I'm speaking from a doctor perspective, have a moral obligation to address health inequalities. And from where I'm standing, we do that by training these community-focused doctors with this strong commitment to general practice, public health, psychiatry. We deliver education which engages students to challenge the status quo, to advocate for their patients. But there's also something about recruiting applicants who previously never thought that they might be able to study medicine, so that we train a cohort of doctors and a population of doctors who more appropriately represent the community from which they come. In other words, we want people who thought they couldn't study medicine, they did a degree in something else, and then they found their academic feat and they showed their ability, and that was no matter what their A-level grades were. And I think there's also something immensely powerful about helping to raise the aspirations and ambitions within a community. So if school children in a region see that we're training doctors, see that we're training nurses, see that we're training allied health professions, then those children will see that is happening on their doorsteps and can begin to see that that is something that they want to get involved in and share a piece of. And there's also something hugely powerful about those students, because students are, even before they qualify, are change agents. Through student groups, student societies, they will work with children in hospital. They will be working with our communities to help deliver life support training and help children understand and conquer their fears about going into hospitals and all sorts of things. So there are many, many ways in which the university and the School of Medicine in particular will, I hope and anticipate, have an impact on our wider community, far greater than just, she says, producing 70 doctors a year. Our first doctors are going to graduate in the summer of 2025, and we are thoroughly looking forward to that moment. And Joe, it's my last slide, and the last slide is just back to the Peace Bridge, and just to say, I think what a privilege it is to be leading this, to have been welcomed by this remarkable, vibrant, friendly city, and I really hope that that we will deliver for the city something of immense value now, but for a long, long time into the future. Thank you very much for your time.
Louise, thank you very, very much. That was great. And thank you for giving the commitment to come to our area and contribute to this really essential project and the work that you do as a general practitioner in our community. So thank you for that. I think, you know, you are what you have referred to in relation to deprivation. You know, we know that COVID has been driven by deprivation. The statistics have told us that. And that's really, really important. It's a key stat that we cannot ignore. So there is a lot to do. So really, really exciting times when you start to see dates in there for students starting. I think probably the reality for you is really starting to kick in. So no, really looking forward to that. So thank you again.